So my name is Kristin and I'm representing WFAD. And WFAD is a fast-growing multilateral community of over 330 non-governmental organizations and 380 individuals in 60 countries representing all regions of the world. And our common aim is to strengthen prevention, increase access to treatment, and promote recovery. And we are very delighted to present you this training together with Drug Free America Foundation, and are very happy and thankful for this collaboration. Drug Free America Foundation is a drug prevention and policy organization committed to developing strategies that prevent drug use and promote sustained recovery. The Drug Free American Foundation vision is a world where all people live free of the burden of drug abuse. Today's training is essential in showcasing the possibilities to navigate in a changing marijuana policy landscape. Attitudes and laws are currently rapidly changing towards a more supportive policies towards the decriminalization and legalization of cannabis. And since prohibition has not prevented, since drug prohibition has not prevented the drug usage and disproportional cost harm, and at the same time, it also is considered relatively safe. However, science has proven the opposite and must therefore lead to conversations regarding marijuana reforms and policies. Yet it's very challenging times where the legalization movement has gained such strong momentum and advocacy strength. Nevertheless, this increases the necessity to work together, make our voices louder, keep educating people, arm people with the data and facts from science, and continue the conversation. There are also examples of successful cases of best practices where legalization has been pushed back from moving towards further legalizations and commercialization. And we're honored to present you our keynote speaker and panelists who will share their experiences, examples, and possibilities in the Americas in global advocacy during this training. So the training itself will be 3 hours and will be divided into 3 sections. First, our keynote speaker, Amy Ronshausen, will share remarks on advocacy in relation to drug demand reduction efforts for 20 minutes. Then the first panel discussion with Dr. Mariano Montenegro and Kristin will discuss effective advocacy strategies and best practices, after which we will have a short break. Then our second panel with Dr. Lombardo Soriano and Dr. Kevin Sabet will discuss advocacy in action. And after each panel discussion, we will have a separate 15-minute Q&A session, which will be moderated by Amy Ronshausen. And you can ask your questions throughout the panel discussion by posting in the chat box or in the Q&A sections, which you will see below your screen. And you're also always free to introduce yourself in the chat box and tell where you're from and have chat with all the other participants. So without further ado, I would like to introduce you to our keynote speaker, Amy Ronshausen. She is the Executive Director of both Drug Free America Foundation and Save Our Society from Drugs, two national nonprofit organizations that work to prevent substance abuse, increase access to evidence-based treatment, and promote sustained recovery. Amy Ronshausen has dedicated most of her adult life to the work of drug demand reduction. In her 13 years with Drug Free America Foundation and SOS, she has assisted in coordinating successful grassroots advocacy campaigns to promote sound drug policy, analyzed and tracked state and federal drug policy legislation, and trained prevention professionals at local, national, and international conferences. Amy Ronshausen regularly testifies on issues related to drug demand reduction on a local and global stage. Thank you for being here with us, and the floor is yours. Amy, are you with us?
I am. I got lost there for a minute, but I think I'm back.
Yes, we can hear you.
So is it time for me to start?
It's time for you to start, yes.
Sorry
The
about
floor
that.
is yours, no problem.
It's always something. Okay, so I'm going to start sharing my screen. Okay. All right. Does it look good? You can see everything?
Yes.
Great. Okay, so I lost Cressida there at the end, so I'm not exactly sure what was said, but I'm going to go ahead and continue. So my presentation is going to be very short, but I want to answer kind of what is advocacy and kind of explain why it's important in the work that we do. So advocacy is any activity by an individual or group that aims to influence decisions within political, economic, and social systems and institutions. It's a lot of the stuff that we do every day without even realizing that is what we're doing. Advocacy includes activities and publications to influence public policy and laws, budgets, and we do that by using facts, relationships, the media, and messaging to educate government officials and also the public. I'm having a hard time with my slides. Okay. For us, our cause is drug demand reduction, and that includes prevention, treatment, harm reduction activities when appropriate, and also advancing recovery efforts. And a lot of times the groups that we work with outside of professionals, because we do work with a lot of different professionals, are associations and institutions and coalitions. And coalitions are made up, as you know, because many of you are part of them, of people from all walks of societies. It could be professionals, it could be law enforcement, medical professionals, education professionals, but also it can be volunteers and family members and people who this isn't their job, so to speak, but this is something that they're passionate about and they're ready to do the work on it. And those organizations traditionally serve populations that sometimes are underserved, and they talk about issues that often have a very limited voice when it comes to the policy process. And a lot of times those groups have the best or sometimes the only information on the social needs that exist to address these issues. So advocates within drug demand reduction experience, and that includes those volunteers and family members, are very vital to the process, the advocacy process, and can help shape and improve policy proposals. You as an individual, whether you're a professional or a volunteer or just a super caring, passionate individual on this topic, you have the ability to educate your elected officials on the importance of these prevention, treatment, recovery, and harm reduction efforts, and encourage elected officials to make sure that they're thinking about those issues and they're incorporating those kind of considerations into all the decisions that they make across all policy areas. And what I mean about that is many of us lately have been involved in the response to the pandemic and COVID-19. So making sure that when we're talking about our response to that we're not just talking about infectious disease and the health efforts that go around that, but we're also talking about how our efforts and the things in our response has impacted people and their mental health, and how that might have impacted substance use, the availability and the accessibility and the increase to use. So even though we might not be talking about something that's very specific to drug demand reduction, and in this case, it would be a pandemic, incorporating those efforts in so that we're making sure that we're having a whole process. And it's important to remember for policymakers who are already very supportive of our efforts and that they're very in tune to prevention, treatment, and recovery, that we don't stop speaking to them, that we don't forget them, because just because they're on our side doesn't mean that they still don't need that education. So we still want to make sure that we're giving them the things that they need. We want to educate policymakers with the latest information in our world of prevention, treatment, recovery, and harm reduction, because that's critical to ensuring that they have the health related, that they can make health related legislation and make sure that it's based on the most rigorous and current scientific evidence and data. And it's an effort that's ongoing. It isn't something that we just do, it's not a one and done. We have to make sure that we're continually educating these policy makers and giving them that right information and the most recent information so that they can stay attuned. But it goes beyond just interacting with policymakers. That is a very important part of this process. But our advocacy efforts help us build greater public support and public education about the roles of prevention, treatment, harm reduction, and recovery, and how that can improve the lives within our community. And what I mean by that is we can use these advocacy techniques by having conversations with our family members and friends and our colleagues, by using our social media platforms to share data, to share resources, to share research that's out there, and to use all that information that we have at our disposal to create publications such as op-eds and letters to the editors to help get this information out to the media. For those of you who have heard me talk before, you know that policy is I'm very passionate about this purpose because I think that it's super important to the work that we do. And I like to think about it this way: by changing laws and shaping the physical landscape of our community, we can have a really big impact with very little time and resources. Because by changing policies, we can look at things like access to care, like evidence-based treatment, substance use availability and accessibility, advertising and marketing, which is going to be a big thing when we're looking at the marijuana landscape, zoning and hours of operation of things like dispensaries or head shops or places that sell alcohol. And policies impact change. It can't just be about education. We are really good at educating people and being part of the information dissemination world when it comes to prevention. But we have to do a little bit more than that. Policy greatly influences the choices we make every day in our daily lives. And if you'll permit me, I will quickly tell a quick story that some of you may have heard before if you've heard me speak on this topic. But what I mean by how it influences the choices that we make every day, I want you to think about some of the policies that are in place in your community, in your state, in your country, such as tobacco-free zones, or wearing your seatbelt, or the fact that we ID people before we sell them alcoholic beverages. And the story I want to tell is when I graduated from high school back in 1992, there were very few colleges that were smoke or tobacco free. And I had never smoked. I didn't use tobacco when I was in high school. And so I got to college my first day, and I drove up to campus, and I started walking to my class, and I saw all these people smoking cigarettes right there in the middle of campus. And I was like, wow, this is pretty cool. You can do whatever you want here. So the next day, even though I wasn't a smoker, I decided to stop at the convenience store on the way to class, and I bought myself a pack of cigarettes, and I got a lighter, and I came to the parking lot. I parked my car, I got out, I put my backpack on, and I lit up my cigarette, and I started walking through campus, and I just thought I felt so cool. But thankfully, I didn't like it. I didn't like the taste in my mouth, and I didn't like the smell of it. And in fact, it made me a little nauseous. So it wasn't a habit that I continued. But my point is, if that would have been a smoke-free campus or a tobacco-free campus, I never would have made that choice. I would have never made the choice to smoke that cigarette in the first place. Now, thankfully, I didn't like it and I didn't continue on that path, but I very easily could have become addicted to nicotine and been, somebody who struggled with a tobacco addiction for the rest of my life because of the choice that I made, because this policy wasn't in place. So think about those policies and those things that we do every day without thinking about, like putting on our seatbelt when we get in a car, that really impact our public health and public safety. So I want to spend the last few minutes of my presentation and just talk about how this applies to marijuana, because this is something that we're all seeing a great push for around the globe. And unfortunately, that we have some unique experiences with here in the US because of the policies that are put in place here. So this just kind of gives you a map where in the world is marijuana legal. And I'll quickly tell you a couple places. So Canada has marijuana legal for both medical and recreational purposes. The US is a little all over the place. We have a handful of states that allow for recreational use, and we have many, many more, almost all of them, that allow for some form of medical marijuana. Uruguay was the first country to fully legalize marijuana for recreational purposes. South Africa allows for the private use and private cultivation and has decriminalized since 2018. Jamaica decriminalized marijuana in 2015, and in 2018, they had their first medical marijuana dispensary opened. The country of Georgia, it is legal for consumption both recreationally and medical, but it's illegal to sell. And as of 2001, June, in Mexico, marijuana is legal for private recreational use. So we have, so we know that this is a fight happening around the globe. And so what I want to show you is just some experiences that we've had here in the US that I know some of my other colleagues later will talk probably more about. But I want to show you what marijuana looks like in our communities, and I want to tell you how this is important to what we're talking about when it comes to advocacy. So this is marketing of medical marijuana here in St. Petersburg, Florida, where I'm located, at a music festival. So you can see that at a family-friendly music festival, they have tents set up to market marijuana with plans, pricing plans. You can see people in line with their beer that was being sold. So this is what medical marijuana looks like in my community when it comes to marketing. Then we also have, this is what's seen around the US and states that allow for dispensaries. You have dispensaries that have neon lights, that have very non-medical names like House of Dank. You see Puff in Detroit, Michigan. You see the big pot leaves on the building in Colorado, and you see a lot of signage, a lot of marijuana leaf signs. You see the sandwich boards. You see a lot of advertising outside of these buildings. And so putting that experience, the visual experience, and adding the data to that is a way that we can educate our policymakers in our communities on these issues. So the reality of legal marijuana sales in the US is past month use is higher in states that allow for the distribution of marijuana through those storefront facilities that I just showed you. And also the density of dispensaries in an area is associated with a greater number of hospitalizations where the primary or secondary care code is marijuana abuse or dependence. And that boils down to every one dispensary per square mile in a zip code is associated with almost a 7% increase in the number of hospitalizations with a marijuana use or dependence code. So this is connecting the data with the realities of what's happening visually in our community. That the availability of marijuana through these dispensaries is positively related to current marijuana use and higher frequency of use. And by advocating for regulations on where these could be zoned and the amount that could be in place, might be able to allow us to restrain the overall levels of use within the cities. This is how marijuana is marketed in the US in states that have it legal. We see different tractor trailers with signs on it. This was here again in the Tampa Bay area where I'm at during our this year. The state of Florida and Tampa Bay in particular hosted the American football Super Bowl. And not only did we host, we won the Super Bowl. But all the families, thousands and thousands of families that were attending Super Bowl walked by this bus as they got there. And as my colleague who is attending with us today likes to say, what this does is it normalizes this in our community, and normalization equals invisibility. And soon people will walk by this and they won't notice it because it's so frequent in our communities, and they won't be asking questions. And when they're not asking questions, then sometimes that means that they think that this is safe and that this is acceptable and it's not harmful. These are some of the products that are being sold in the dispensaries. You've got marijuana sodas, marijuana candies, gummies, things that are very similar to products that we already have on the market. So that youth would be very, they would know what Runts candies are. And so they would associate that with something fun and yummy that they would want to eat. And really it would be marijuana. We have all these ads on social media. Some of them are using cartoon characters that are very familiar to our youth, in this case, Cookie Monster. And then we have just, free spirited and friendship and, just kind of a peace-loving community is what's being sold here when it comes to these products. These are more ads on social media. This one in the bottom right-hand corner is probably the one that gets to me the most. This one came out at Christmas time, and this was a dispensary that was reminding you to make sure that you left out your marijuana extracts for Santa when you put out your cookies and milk the night before Christmas. But again, using cartoon characters, using things that we enjoy. And why is this important? So there was research that was done by, in California with 6,500 different kids that went to a very diverse population that went to 16 different middle schools in Southern California. In 2010, when they surveyed them, around 25% reported seeing these ads. And, in this particular research looked at billboards. And they saw in 2017, that number grew to 70%. What's important about this is teens who reported seeing these ads were more likely to report having used marijuana in the previous 30 days. They said that they expected to use it within the next 6 months, and that they expressed more positive beliefs about marijuana, such as agreeing that marijuana could help them relax, let them have more fun, or allow them to temporarily escape their problems. So the marketing that's employed by this industry is really working when it comes to what our youth believe. So our job, to wrap this up, is in advocacy, is to take that data, take that science, and take those experiences of what we see in our communities, and use that to promote policies that put public health first. We want to make sure that everything that happens when it comes to policies that are implemented in our country, in our state, in our nation, at the local jurisdiction, put public health first. And anything that would increase access and availability to marijuana or other drugs would not be accomplishing that. So we want to make sure that, this is what we're doing. So in this case, really our work is never done, because whether or not marijuana is legal where you're at now, there is a push for it. So it's important to start collecting this data and learning the proper ways to advocate against this. But if marijuana is legal where you're at, there's always work that can be done to help regulate it more, to minimize the harm that's associated with its use, and to not have those negative outcomes that I'm sure that some of our other speakers will talk about later. So that is where I'm going to end, and I'm looking forward to hearing from our amazing panel, and I will stop sharing my screen. I think I've done that properly.
Thank you so much, Amy. That was a great presentation on basically giving a brief overview of how much advertising is being held in the US, where things have been legalized, and the commercialization. I think one thing what was striking was what you said with normalization equals invisibility. Like the more normal we find things, the less we ask about it, and the more normal we think it, we can start to use it. So thank you for that, for showing that. And I think the rest of the panel will basically dive into the second part. What you said is that advocacy is never done, and we will have to continue working on it and continue finding ways in either not legalizing it, stopping the legalization, or minimize the harms. So I think, thank you so much for sharing that with us. I will then share again. I'll introduce our next speakers, which will basically, we will start with our first panel, the effective advocacy strategies and best practices. And in this panel, we have two speakers, and I'll introduce them both separately. So the first speaker is going to be Dr. Mariano Montenegro, and he is a medical doctor and psychiatrist of University of Chile with a Master in Science in Substance Addiction and almost 20 years of experience in public policy and training in demand reduction, as well as clinical treatment of people with problems of drug use. And he's currently the director of the Colombo Plan Office for Latin America and the Caribbean and external consultant for the United Nations Office for Drugs and Crime in Vienna, the UNODC, and working as a mentor for policymakers in Latin America on demand reduction. Previously, he was the national director of the National Service for Prevention and Rehabilitation of Drugs and Alcohol at the Chilean Ministry of the Interior, and from 2000 to 2010, he was the head of Health Treatment Rehabilitation and Reintegration Unit at the Chilean National Council for Drug Control. He will be sharing his practices in Spanish, and those who joined us later and want to hear this English translation, you can choose the English translation in the interpretation button. And then our second speaker in our panel, she will be Kristin Kidd. She serves as the coordinator of the SAMHSA-funded Southeast Prevention Technology Transfer Center at Waukegan Forest School of Medicine, with a focus on health equity, workforce development, and policy. The Southeast PTTC provides free training and technical assistance to the substance misuse prevention field in the Southeast. Kristin is also the director of the North Carolina Behavioral Health Equity Initiative, which partners with 8 grantees working to impact the local health disparity issues. Kristin was formerly the director of the Tobacco Control Training and Technical Assistant Team at the Colorado School of Public Health. There, her team provides statewide advocacy and policy guidance to the local health agencies working to eliminate tobacco disparities. Kristin partnered with multiple Colorado communities to successfully pass local tobacco control policies such as retailer licensing and expanded smoke-free and vape-free protections. In her limited free time, Kristin enjoys mountain biking and trail running and gardening. Very nice. Thank you both for being here with us and sharing your valuable experiences and best practices. So first, Mariano, the floor is yours.
Okay. Can you hear me?
Yes, we can hear you.
Perfecto, perfecto. I'm going to speak in Spanish, so I'm going to put my presentation. Voy a hablar en español. Voy a hablar en español ahora para que podamos ver esta presentación. ¿Se ve bien la presentación? ¿Sí? ¿Estamos
we
bien?
Can see
¿Sí?
it.
Very well. Thank you. Ok, bueno, muchas gracias, Amy, por haberme invitado a esta presentación. Creo que esto es un tema crucial. Vamos a hablar en particular de la marihuana, sin lugar a duda, pero creo que es muy, muy importante pensar que tenemos que tener advocacy en reducción de la demanda, ¿no es cierto? Lo que siempre quiero adelantar es que cuando estamos hablando de marihuana es tan lamentable cuando uno ve esa propaganda que tú muestras, que es tan parecido al tabaco y tan parecido al alcohol, donde me recuerda el principio del siglo XX, ¿no? Que fue un desastre. La propaganda del alcohol, la propaganda del tabaco que ha destruido nuestra salud individual y nuestra salud colectiva, nuestra salud pública. Son los 2 factores de riesgo más graves de nuestra salud colectiva, poblacional e individual, el alcohol y el tabaco, y con marihuana están queriendo llevar el mismo camino errado, equivocado, que se llevó con el tabaco y con el alcohol. Lo bueno es que ahora tenemos tanta información, no como a principios del siglo XX, que había poca información de tabaco y poca información de alcohol, donde no se podía contrarrestar fuertemente y no había mucho respeto en esa época por la evidencia científica. Creo que hoy tenemos más herramientas para poder luchar, para proteger la salud pública de nuestra población. Bueno, lo primero que quiero mostrarle es que el tema de la salud, de las drogas en general, el uso de drogas, es una preocupación general, pero es mucho más, esta preocupación es mucho más común en los que nos dedicamos a este tema, ¿no? Entonces también tenemos que ver cómo este tema es importante, más importante de lo que está haciendo para la población general y para los tomadores de decisiones. También sabemos que hay muy pocas personas que entienden que en el fenómeno del uso de drogas hay una ciencia que está detrás. Es decir, esto está basado en la ciencia, ¿no es cierto? Y mucho menos personas conocen cómo, en el fondo, hacer una buena prevención, un tratamiento y una integración social en el tema de las drogas. Lo que quiero decir con esto es que hay mucho desconocimiento, por lo tanto el entrenamiento, el ilustrar a la población es muy crucial y partiendo fuertemente por los tomadores de decisiones y la gente que influye, que tiene influencia en otros. Ahora, yo creo que una de las cosas que yo me atrevo a compartir con ustedes, porque yo fui 10 años el director de tratamiento de la Comisión de Droga y fui 2 años el director de la Comisión de Droga, el SAR de las drogas de Chile, de mi país. Y la verdad que me armé una convicción de que estas 5 cosas son cruciales para que podamos tener éxito con la reducción de la demanda. Tenemos que tener un fortalecimiento institucional de las comisiones de droga a nivel nacional, a nivel regional y a nivel local en los países. Eso está todavía muy débil en todo el planeta en general, excepto probablemente los países desarrollados. Pero los países de ingresos medios y los países de ingresos bajos, el fortalecimiento institucional es muy frágil. Entonces, a veces podemos tener instituciones fuertes nacionales, pero con una representación regional y local muy escasa, muy bajita. Tenemos que tener modelos, sistemas y programas basados en la evidencia científica en la reducción de la demanda. No cosas mitológicas, creencias, sino que ciencia. Pero aquí puse 2 cosas en color, que es la que yo me voy a dedicar y me dedico actualmente, que es el entrenamiento a los tomadores de decisiones, que es crucial, que lo planteaba Amy muy bien en su presentación, pero también entrenar a la fuerza de trabajo, a la gente que está en la primera línea, la que está en la trinchera. Tiene que estar muy bien ilustrada porque esos soldados, llamémoslo así, esa gente que es de terreno, que está en el territorio, en el field, ¿no? Nos permite a nosotros tener una fuerza que pueda defender la salud pública. La advocacy también es crucial, ¿no es cierto? Que es cómo nosotros desde las comisiones de droga podemos influir en todos los otros sectores que tienen que ver con la prevención, el tratamiento, la integración y la conciencia de que esto es un riesgo enorme para el desarrollo de nuestros países. Y la quinta punto importantísimo es que todo lo que hagamos, tiene que ser pensado para ser implementado a nivel local, ojalá en un county, en un municipio, porque ahí es donde realmente llegan las cosas a los ciudadanos. A veces hacemos cosas a nivel nacional, incluso a nivel estatal o regional, pero que todavía no les llega a los ciudadanos. Donde les llegan las cosas a los ciudadanos realmente es a nivel local. Les quiero mostrar la situación en América, en nuestras Américas, porque aquí es información de la OEA, de los Estados Americanos, la Comisión Interamericana de los Estados de drogas, de los estados de la Organización de Estados Americanos, y nos dice qué cosa. Primero que tenemos 1.000 millones de personas aproximadamente en todo nuestro continente, desde Canadá hasta Chile. Son 35 países tenemos una diversidad cultural, económica, lingüística, en idiomas y étnica enorme. Tenemos problemas diversos de droga en nuestros países, pero a pesar de esta diversidad, tenemos algunos temas bastante comunes y bastante transversales que los debemos compartir. Ahora, no olvidemos que en nuestro continente tenemos el país más rico del mundo, Estados Unidos, y el segundo país más pobre del mundo, Haití. Por lo tanto, es una diversidad muy, muy amplia que, por ejemplo, Europa no lo tiene. Europa tiene mucho más cohesión, por lo tanto, la diferencia no es tan abismal como la nuestra. ¿Qué es lo que nos pasa con la situación del consumo de drogas en nuestro continente? Tenemos buenas noticias. El tabaco va claramente hacia la baja. Muy mala noticia, la cannabis va hacia la alza en todos los países que tienen estudio de tendencia. La cocaína tiene algunos países que está hacia la baja, otros hacia la alta, otros se mantiene, está relativo. Y los estudios de estudiantes, adolescentes, que probablemente mi compatriota Humberto Soriano va a hablar más de los niños y los adolescentes, claramente tenemos aumento de cannabis en casi todos los países y la cocaína un poquitito más variada. Pero la marihuana es francamente el gran problema con el tabaco y con el alcohol. Pero la marihuana es la que va a la alza. Una mirada de otras sustancias para que no nos vayamos a desconcentrar, porque lo que hace generalmente la gente que está en el alcohol, el tabaco y la marihuana, quiere que miremos otras sustancias para distraernos de realmente las sustancias que están realmente destruyendo masivamente la salud de nuestros pueblos. El éxtasis es muy poquito, ustedes ven ahí las prevalencias son muy bajitas, y los inhalables, los tranquilizantes, los opiáceos, los opioides, las nuevas sustancias psicoactivas son preocupantes, pero son francamente de una prevalencia baja. Las principales entonces sustancias en el continente, sobre un 10%, es decir, que tengan 2 dígitos de prevalencia, es decir, peso enorme en el uso en nuestra población, es el alcohol, pero está yendo hacia abajo o está estabilizado. El tabaco está yendo hacia abajo, buena noticia. Y la marihuana constantemente subiendo, muy mala noticia. Por lo tanto, esto es lo que nosotros tenemos que decir, este es el problema de salud poblacional. Cuando estamos sobre el 10%, 20, 30, 40, 50% de uso, estamos con un problema de salud poblacional. Cuando estamos en 2%, 0,5, 0,9, son pequeñas poblaciones graves que las tenemos que ver, las tenemos que asumir, pero no es un gran impacto poblacional. Cannabis, ¿no es cierto? La cannabis, ¿qué es lo que nos dicen los estudios de nuestra región? Tenemos un amplio espectro, ¿no es cierto?, desde intensidades bajas de consumo a intensidades altas de consumo en todas nuestras Américas, pero todo va hacia arriba. En la población general, ¿no es cierto?, va desde 0,5 hasta 16% de uso, especialmente Canadá, Estados Unidos y Chile. Uruguay y Argentina son las prevalencias más altas de marihuana en todas las Américas. En los estudiantes, ¿no es cierto?, tenemos una tragedia, tenemos desde muy bajito, de 1%, pero llegamos hasta 32,8% de los estudios de estudiantes, que esa es la cifra lamentablemente de mi país y que Humberto probablemente va a hablar más de aquello. Cosa que ya la estamos bajando, eso era el año 2014, el 2016 es 30%, el 2018 es 26%, porque hemos hecho cosas para bajar. No en vano yo fui el director de la Comisión de Droga y me propuse quebrar la curva, y ahí podemos conversar todo lo que hice en términos de advocacy también para poder quebrar esta curva fatal. La mayoría de los países el uso de cannabis es más en hombres que en mujeres. Pocos países en Norteamérica y Sudamérica la prevalencia de ambos sexos es la misma. Pero esto es muy importante cuando lo dijeron al final de la presentación, que en todos los países donde el 20% o menos de los estudiantes percibe que es de riesgo el uso de cannabis ocasional, la prevalencia son sobre 15%. Es decir, cuando tenemos normalizado el consumo y la percepción de riesgo es bajita, tenemos que estar alerta a un posible aumento del uso de cannabis en el futuro. ¿Qué es lo que nos dice las convenciones, ¿no es cierto? La Asamblea General, la sesión especial de la Asamblea General de Naciones Unidas del 2016, que a mí me tocó estar porque yo era director de la Comisión de Droga, estuve en Nueva York, y ahí, entre todo, volvimos a respetar las convenciones, dijimos que el consumo de droga es un asunto de salud pública, respetamos los derechos humanos de los usuarios de droga, todo debe hacerse en base a la evidencia científica y se debe considerar el género, la edad y las pertinencias culturales y étnicas. Pero los defensores del uso de marihuana, que es de la otra vereda y que no tenemos que ser ingenuos, tiene una diversidad de características. Y yo diría, los que defienden la marihuana, primero son los defensores del derecho a consumir marihuana. Lo dicen mucho, como un gran derecho. Un derecho a consumir, pero por supuesto que después quieren que el Estado pague las consecuencias. Entonces, eso es no coherente, ¿no? Tienen un desconocimiento y una negación de los efectos dañinos. ¿No es cierto? Hay mucho mito, muchas creencias y mucha pseudoevidencia que se ha dado justo con promocionar el eventual uso médico de cannabis, lo cual la evidencia dice todo lo contrario. La evidencia dice que no hay uso médico, ¿no es cierto?, en la que se ha hecho seriamente. Hay mucho fanatismo y militancia frente a la marihuana, y hay una falta de preocupación por la salud pública de nuestros pueblos. No aparece nunca en sus discursos. Y por supuesto lo que está detrás en muchos de ellos es el gran negocio, la propaganda y el marketing. Entonces, evidentemente una de las primeras sugerencias en la advocacy, yo diría, para las estrategias de cannabis, es que tenemos que tener muy seriamente y muy sistematizada la búsqueda de evidencia considerando los eventuales usos de marihuana, el uso de marihuana para los eventuales efectos terapéuticos. Eso nosotros lo hemos hecho en Chile y lo que se demostró era que no había efectos terapéuticos, era propaganda o era pero muy débil la evidencia que lo apoyaba, y todos los medicamentos alternativos eran muy superior a los cannabis o sus derivados. Pero yo llamaría a este grupo que deberíamos tener un serio y sistemática búsqueda de evidencia de los efectos dañinos, pero no solo en salud, porque ya lo sabemos en salud, sino que en educación, en el trabajo, ¿no es cierto?, la disciplina laboral, el ausentismo laboral, los accidentes del trabajo, la productividad baja, todo lo que es en el transporte o en la seguridad vial, ¿no es cierto? Todo lo que es la seguridad pública, ¿no es cierto?, en términos de criminalidad, todo lo que es la violencia doméstica, todo lo que es la convivencia comunitaria y todo lo que es la corrupción, tanto pública y privada, cuánto afecta la presencia de marihuana en todo esto y cuánto es el daño en todo esto.
Sorry, Mariano.
Ahora, yo diría,
Just a
¿ya?
quick,
Ya.
ju- a quick note.
Sorry?
There's 3 more minutes on the clock.
Okay, I'm finished.
Yeah.
Thank you. Sorry. Entonces, finalmente, lo que yo les quiero decir es que nosotros debemos entrenar, como decía Amy, y yo creo que una de las estrategias importantes es entrenar. El Colombo Plan tiene un programa de advocacy para entrenar a las personas en esto, y la idea nuestra es que este currículum debe ser para reducción de la demanda, donde el tema de la marihuana tiene que estar metido dentro de poner relevante el tema de reducción de la demanda. Y por supuesto que es poner en el fondo todos estos objetivos generales, es cómo los metemos en los sectores de las universidades, las comunidades, en los tomadores de decisiones, en la gente que está aplicando la ley, en las otras ONG y en los medios de comunicación. Y porque principalmente, ¿no es cierto?, la advocacy, ¿en quiénes? ¿No es cierto? En la primera línea de la gente que hace incidencia política, en los profesionales responsables de las relaciones interinstitucionales y las vinculaciones con otros sectores, en los directores de programa y en los tomadores de decisiones. ¿Y por qué? Porque la evidencia, digamos, hay que enseñarle a transferir lo que la ciencia sabe a los tomadores de decisiones, y eso no es fácil, ¿no es cierto? Y también tenemos que meternos en los medios de comunicación. Eso absolutamente crucial, o si no, no existe el problema. Entonces, al final del curso, nosotros queremos que existan estas capacidades para poder lograr terminar un curso exitoso de entrenamiento, que ya lo tenemos listo. Estamos, yo creo que en unos 3 meses ya en condiciones de entrenar en este curso. Y los contenidos de este curso son estos 11 capítulos que ustedes los están leyendo ahí y que yo diría que son cruciales para poder entrenar bien, porque esto hay que entrenar en advocacy, en la capacidad de la incidencia. Hay, hay, hay capacidades personales, hay talento, pero también se requiere entrenar. Y estos son los últimos capítulos que nosotros tenemos, donde tenemos también un momento de trabajo práctico que es muy, muy interesante dentro de este entrenamiento. Muchas gracias y disculpen por haberme extendido un poquito. Muchas gracias.
Thank you, Mariano, for your great contribution and showcasing the situation in the Americas and how everything is different and all the steps that we have to go through, basically, in order for advocacy to work. Without holding many more, or like holding you, Kristin, I would like to give the floor to you and give you the time to give your presentation.
Thank you, Cressida. I appreciate it. And thank you, Amy and the WFAD for inviting me to be here today. I'm really excited to present some information, and it's really an honor to be a part of this amazing group of professionals. So thank you. So as Cressida said, I'm with the Southeast Prevention Technology Transfer Center here in the States. And we're funded by the Substance Abuse Mental Health Services Administration. They're with the federal government here in the US. And they fund the Mental Health Technology Training Center, the Addiction Technology Training Center, and I'm with the Prevention Technology Training Center. And we're all about building the capacity of the prevention workforce and providing them free technical assistance and training and tools so that they can do the work. And this is the group that we serve. We serve 8 states in the Southeast. We make up about 20% of the US population, and we're a very diverse region. 7 of the 8 states have a higher African-American population than most of the other US states. We have 6 federally recognized tribes, and we have a rapidly growing Latinx community, and we have a very large rural population. We do have some large major metro areas like Charlotte and Atlanta and Raleigh and some down in Florida, but we do have a large rural community. So there's a lot of diversity that we're trying to, excuse me, serve those needs so that the information that we share is really applicable to all of the prevention professionals trying to serve these communities. And we are actually located in North Carolina at the Wake Forest School of Medicine. So we have 3 buckets that we're really interested in everything that we do. Workforce development is a really big focus of ours. And then equity, we try to infuse the lens of equity across everything. And then really most pertinent to the conversation today is policy change. That's really, that's my area of focus within the PTTC. So as Cressida said, I was out in Colorado for many years working on tobacco control prevention. And as I hear people talk about the marijuana industry, I just can't help think that just like alcohol, marijuana is really following that tobacco playbook. Before here in the US, they were heavily regulated. So let's move on. With policy, what I think is so important is that from this, this health impact pyramid here, we're really focusing on the lower half of the pyramid. It's really about changing the context, changing the environment to help make it easy for people to make the healthy decisions. And pulling in the idea of equity, it's important to think about those social economic factors, those social determinants of health, and making sure that our policies are really seen as social justice tools, that we're trying to remove disparities and improve equity. And when I was out in Colorado, we had just started moving into really focusing heavily on tobacco control policies. And I was working with a youth engagement group. It was Colorado's youth movement against the tobacco industry at the time. And the youth were doing we were really trying to build their public speaking skills and empower them to find their voice, really as a way to prevent them from using. But then the program really shifted. The funding dollars from the state health department in Colorado wanted us to focus on policy change. So I started working with these youth groups, these youth coalitions and their adult sponsor, to get them to think about policy. So there was a whole bunch of education that had to happen and skill building on first what advocacy is and how policy plays a role in improving your community. So really it was a big culture shift for them. And I'm seeing that here in the Southeast as we're working with the prevention workforce and really trying to encourage them from our PTTC to think about policy change, that changing the environment and changing the context is only going to make those more midstream strategies that you're doing more successful. So it's about moving upstream with our tactics to focus on laws, policies, and regulations to really reduce the harms brought on by some of these industries. And where we try to focus our work is really with the 4 Ps. So the sale and use of alcohol, tobacco, and now cannabis, they're really strongly affected by these environmental conditions commonly executed by the industries through influencing those 4 Ps of marketing, which is place, refers to where the products are sold, price refers to the retail pricing, which includes the use of couponing and other discount strategies. Then there's the products themselves and includes the look of the products. And it also includes things such as flavoring and especially with marijuana, the massive variety of types of cannabis products that are out there. And then there's promotion, refers to the advertising and the display and other related strategies. So public health and prevention professionals can use these same strategies utilized by the industries to change the environmental factors that influence behavior and thereby improve health outcomes. So even the World Health Organization has their best buys, which are really those cost-effective and impactful strategies. And if you look at their best buys, they're really talking about those 4 Ps. The World Health Organization supports increasing excise taxes and price, enforcing a ban on advertising, promotion, and sponsorship, restricting the availability of where these products are sold, and other such strategies. Recently, SAMHSA, as recent as October this month, 2021, SAMHSA came out with this guide that covers programs and policies to prevent marijuana use among youth aged 12 to 17. And there's a little QR code on here. You could take your cell phone over it and it will take you to the PDF so you can download this tool. But even in SAMHSA's guide, it talks about environmental strategies such as regulating the price of cannabis, where they're sold, the products themselves, and their promotion, that these are all strategies that can really help make a difference. So a question is, how do you do this? And really, Amy gave a really beautiful overview of what advocacy is, and Mariano talked about emphasizing the local level, working at the local level, and that's where we really focus at the Southeast Prevention Technology Transfer Center. In our bucket of policy, we have this 10-step policy adoption model. And this really originated in California, as many things do, back in the late 1990s, as Michael Sparks and Sharon O'Hara were working with community coalitions on local alcohol policies. The funders were increasingly encouraging these coalitions to work on policies. And this model came about as a way to guide these coalitions and their work. And it really came about, it was, I'm sorry, oops, just jumped forward. It was really developed in the context of the challenges that these local communities were experiencing as they struggled to pass a range of policies. And so we have this 10-step policy adoption model that is basically done in a linear fashion. And we have some tools and resources that help the people here, whoever takes our courses, that helps them do these steps. But you've got steps 1 through 5, which focus on the internal processes of the coalition. And this work is really about laying a strong foundation and building the capacity of the coalition and its members to do this work. Because remember, this is, for many coalitions, this is a huge culture change. This is a culture shift in going from maybe health fairs or working with curriculums with students to doing this, this environmental change policy. So we start them off working behind the scenes by drafting a policy action statement, kind of all coming together to agree what it is they're doing, what the policy is about, and having a roadmap for where they're going to go. We encourage them to work with the enforcement entity, collect their data, and we have a 3-tier data structure for that, where they talk about the prevalence, they talk about the high-risk settings where the problem occurs, and they also capture data on the consequences. Because as you know, the importance of data is really about telling a story. And it's about, I was thinking about what Amy shared today, her presentation. The thing I remember most is the story that she shared about her experience on the college campus. So making sure you're capturing, you know, the quantitative data as well as the qualitative data. And then we talk about developing an issue brief, and then we encourage them to draft the policy language. Ideally, you're using policy language from other communities around you that you customize to fit your local community or your local context. And then we move into steps 6 through 10, which is now you're out on the public stage. And these steps are much thicker and meatier, like step 6, utilizing media advocacy. That's a really big process and involves a lot of what both Amy and Mariano were talking about with framing your messages and working with your local media. And then step 7 is another huge one. That's organizing and mobilizing the community. That's organizing and mobilizing both the grassroots, the building your power base with local community to include the voice of young people. Also working with the community of interest, the community that the people who are really suffering from the problem, making sure that you're engaging them. As Carlton Hall always says, nothing about us without us. So making sure you're engaging those people impacted by the policy and giving them a voice. And then of course, there's preparing to present the policy, which has a bunch of steps to it. And then there's the all-important supporting the implementation and the enforcement of the policy. Because if I were to open the municipal code of the town I live in, I would see hundreds of policies, and I bet maybe a quarter of them are actually implemented well and enforced. So when you're working in the coalition on a policy, we really stress the importance that 50% of your work is getting that policy passed. The other 50% of the coalition's work and effort is ensuring that this policy is implemented and that it is enforced. And then step 10 is evaluation. I kind of don't like that step 10 is evaluation because I feel like we need to make sure that it's infused throughout, and it is in our framework, but we just had it, Sparks and O'Hara had it as step 10 to make sure that it's not lost. That it's clearly the evaluation is a part of the process. So within this policy work, I really like to stress, kind of as a recap, the 3 E's and the 3 P's. And that's that the policy that you've selected, that the coalition has selected, is effective, it's efficient, cost efficient, and it promotes equity. That we understand that really what we're trying to do is remove the disparities and promote equity within our communities, and also stressing that what we're doing is social justice work. We're really trying to change environments and improve environments so that we all live healthier, happier lives. So the people that are doing this work, you've got to have the 3 P's. You've got to have passion, you've got to be persistent, and you've got to have professionalism. So criteria for the specific policy selection. And this is, again, recapping what Amy said and Mariano, that you want to follow the data. You want to make sure that the policy solution that your coalition has come up with and that is working with decision makers to promote follows the data. You want to make sure there's a clear line showing how this policy is going to impact this data that supports the talks of the problem. And that importantly, it's going to result in real equitable improvements in people's lives. You want to make sure that the policy is winnable, widely felt and deeply felt. And that's where a lot of that media advocacy and organizing comes in. Winnable, making sure that it's legally feasible and politically viable within your community. Sometimes it depends on who your funding source is as to what sort of policies you can work on. Some people are not permitted to do lobbying. Some groups could be the funding stream. It could be the makeup of your coalition. So you've got to make sure that you understand all of that. Moving on, you want to make sure that the policy that you're working on really gives people a sense of their own power. And by people, I mean really the coalition that's working on this and the community that you're working to improve the lives of. In your organization efforts, again, make sure that you're engaging those communities that this policy is going to impact and help them find their voice. That also speaks to that whole grassroots organizing as well. And really importantly, that all of this policy work is going to set your coalition or your group or your task force up for the next campaign, because it's all about building people's skills and understanding of this advocacy process and preparing for what's next, always planning for down the road. So I'm going to share just a few best practice strategies or a few things to think about in your advocacy work. Again, I've said this, building the capacity of your partners and your teammates, your coalition, whatever term you use for advocacy work. Amy said it, it's all about relationships, relationships, relationships within your coalition and staying cohesive in your engagement efforts with grassroots and grass tops, influential community members, and with those decision makers. Not just with the decision makers, but with their staff. That's where you get a lot of the work done, working with the people who support these powerful decision makers. I said this already when we talked about Amy's presentation today and her story about the college, that the data that you share, as Mariano says, you need to pull in the science and the evidence. So the data needs to connect with people's heads, but it also needs to connect with their hearts. If you really want to move people to support you and decision makers to accept this policy and be willing to support it and pass it, you've got to connect people's hearts as well. And you really want to alter the relationships of power. Those people who typically don't have a voice, who are never engaged in the process, you really want to alter the power by giving them the power to promote change. Celebrate short-term victories. Sometimes policy change, getting a policy passed, especially at the local level, it may be quick. It may be that the community and the decision makers are primed for it and they want it. And it may also take a long time. It's where that persistence comes in. So make sure you have short-term victories along the way that you and your group can celebrate. And make sure you're organizing grassroots, the community organizations, the parents, the students. Be creative in who you're organizing. Think about bringing people in who can support your policy from a variety of values and positions. So make sure you're organizing the grassroots as well as those grass tops, those influential people that are connected to the decision makers. Maybe they go to religious institutions together, or maybe they play golf together, or they play cricket together, whatever it is. Those influential people are also very important. They're a little more obvious for many of us than focusing on those grassroots people. So don't forget them. And as I said, actively support the implementation and enforcement of those policies. Don't just celebrate the policy passed. There's a lot of work to be done, and do not quit on it. So the work that we share, we have a number of ways we deliver this. We do webinars. We have developed some asynchronous courses that all of you can access. If you go to healthyknowledge.org, there's the website. We have 2 courses. One of them is an introduction to the power of policy, kind of explaining a little bit about what Amy said today about what is advocacy and why policy. And then our second course, the 10 steps of policy change, takes you through that framework that I just discussed. We also have a guidebook that talks a little bit more about the 10 steps. You can you can take a picture or put your camera over this QR code if you want to download our guidebook. And here below is our website. We have some resources, but our sister PTTC network across the US also has resources for you. So in closing, I just want to reference what Carlton Hall, who's I think he's on this call, he said it a few presentations back for the World Federation, that prevention is more than just a science for him, it's a craft. And really that's what policy work is. That's how I see it. The practice of policy is really the craft of blending the art and the science. It's about that evidence base and the science of politics, the science of messaging, with the craft of being creative and innovative and working off the cuff and engaging the right people. So I love the creative side of it. And that's where I really try to tap into people when I'm training them on policy, that you can be as creative as you want. And one of the best places to find that creativity is where do you think? It's working with young people. They have so much more energy than we do. They're braver than we are, so don't forget to engage young people in your policy work. So if you'd like to sign up for our newsletter, this is our newsletter. If you want to be kept abreast of any trainings that we do on, around workforce development or equity, we also have a regular prevention series that runs on a variety of topics. So I just want to, again, thank you for allowing me the opportunity to be a part of this amazing group. I'm really excited with everything that you're doing. And I'd like to acknowledge again, Michael Sparks and Sharon O'Hara for their amazing framework that I really am happy to be sharing with all of you. And then our 2 co-directors, Mark Wolfson and Kim Wagner at Wake Forest, and Dr. Wolfson is at the University of California in Irvine. I'd like to acknowledge them as well. And that's all I have. So I'm going to stop my share and hand it over.
Thank you so much. Thank you for your great presentation with the very clear tools and best practices. I think it's very helpful for everyone to have it just in an order and see what in a very clear imagine what they have to do. So I think it was very helpful for everyone. And yeah, as you said, it's all. I like the very ending what you used with what you have been inspired by Carlton. It's like practice of policy is the craft of blending the art of science, and I think that was a very strong end statement. So thank you so much for that. We will now go to the Q&A. We have some questions, so we have a 10-minute Q&A session. I have one question for each, including Amy, who did our opened this session. So I'll start with a question to her and we'll see how far we'll get. So the first question to Amy is that Europe and the US are very intentionally in pushing for the legalization of marijuana in middle and low income countries. How do we impact policy at the global level against these odds?
That's a great question. I think that one of the things that we talk about at both Drug Free America Foundation and at WFAD is making sure that your organization has a global voice. So we need to make sure that we have really good representation at global levels, such as the Commission on Narcotic Drugs meetings, being a member of the Vienna non-government committee organization, the Vienna NGOC, because these are where we're allowed to have our voices as members of civil society heard. And then also being engaged where they're talking about these issues, such as last year when they were talking about them at the WHO and looking at these new recommendations. I think that also when we look at, it is a very purposeful target when we look at the lower income countries, because they don't have the infrastructure to push back or to regulate that some of the other countries have. But I think that we can also use that to our advantage, because, for example, in the US and in Canada, we have a very robust infrastructure at our disposal that we could be using better, but that we are using to regulate products such as alcohol, tobacco, and even marijuana now. But even at that level of infrastructure and regulation that we still have very dangerous consequences when it comes to public health and public safety on how these products infiltrate our communities. So how is that going to fare out to countries that have, at lower income countries that don't have that infrastructure? So talking to their policymakers and showing the examples that are happening in the US and in North America in particular, and saying, they have a lot at their disposal to, work on these issues, and they're still having devastating consequences. How are we as a country that doesn't have those things at our disposal going to handle this? And I think that might help policymakers second guess what's coming from the industry, because the industry is just telling you, do this, it's a personal right, it's going to bring you a windfall in economics, but the reality is quite different. So sharing those experiences from other countries is, and I'll leave it at that to give time for more questions.
Thank you, Amy, for your very elaborative answer. It was very great. The next question I'll ask for Mariano. Do your statistics in Latin America and the Caribbean show any difference between girls and boys drug use and the marijuana use? And if so, what is the gender-specific difference?
Bueno, ¿se escucha bien, sí? ¿En inglés está bien la interpretación? ¿Lo escuchan?
Yes, I could.
Perfecto.
Yes.
Lo que hemos visto en América Latina es que en los estudios de escolares hay una mínima diferencia en el uso de marihuana entre hombres y mujeres. Es decir, las chicas, las adolescentes han empatado a los hombres, pero hacia el alza. No los hombres han empatado a las mujeres a la baja. Es decir, comilla, puede ser, es una masculinización de las chicas en el consumo. Eso es lo que yo podría decir, pero hoy día están hombres y mujeres adolescentes muy, muy parecidos, mientras cuando llega el momento de tener hijos, en adultez, 4 veces más los hombres que las mujeres. Ahí, francamente, nuevamente, los hombres están arriba. Y creo que es muy interesante ver esto porque la igualdad es la igualdad de derecho, por supuesto, es lo que es fantástico, es lo que tenemos que impulsar en género. Pero justo esta es un empate que ha sido muy negativo. Y yo creo que es muy interesante cuando Amy plantea lo que estaba planteando hace un rato, porque una de las cosas que a mí me impresiona es que, con la pregunta anterior también, es que la gran mayoría del planeta no está a favor de la legalización. Eso siempre hay que decirlo fuerte y claro. Los Estados miembros votan una y otra vez en contra. Son muy poquitos los países que han votado legalización. Lo que sí hay una discusión un poquitito más fuerte en despenalizar el consumo y tratarlo como un asunto de salud pública, que no es legalización. Entonces, eso hay un poco más de fuerza. Y creo que eso hay que decirlo fuerte y claro, porque no es que hay una gran ola. Hay una amenaza. La industria quiere legalizar porque quiere tener clientes cautivos como el alcohol y el tabaco. El alcohol y el tabaco, lo más grave que tienen, además de sus daños mismos, es que son legales y el acceso es enorme. Eso es lo que quieren los traficantes, que el acceso sea enorme. Y el enorme acceso lo hace la legalización con la promoción. No, muy interesante. Y yo creo que hay que decir una y otra vez los daños que produce la marihuana. Aquí no estamos hablando de una planta tranquila como el chamomile, ¿no es cierto? O lemon babina. Esto es algo que daña y hay mucha evidencia que lo dice. Por eso estamos reaccionando. Gracias.
Thank you so much for your answer, Mariano. It was very well and very clear. The next question I have is for Kristin, and that question is as following. What do you see as the most effective and concrete prevention work to reach young people's sense of participation in healthy choices in their own lives?
Oh, that's a really good question. I would say engage them in advocacy work. In my work in Colorado, when we were doing the youth movement, we really were mindful to engage the young people in the middle schools and high schools who were not the captains of the football or American football team or baseball team, or those high achieving students. We really focused on engaging those non-traditional leaders, as we called them, and those students that were struggling, or those students that felt alone. We brought them into these coalitions and helped them find their voice and taught them skills. We taught them about the industry and how they target them. It was really modeled after the Truth Campaign, which is really about tapping into that need for kids to rebel, but to teach them about the industry and how they're pawns and targets of the industry. And we taught them how to rebel against the industry. And with just a little bit of training and coaching, to see them excel, to become a part of a group that accepted them for who they were, and to see them find their power and their voice was really something. So I would say engaging those youth in the process that maybe you might not normally engage in advocacy work.
Thank you so much for your answer to that. We do have some more questions, but I'm also looking at the time, since we would also have a short break from now till past. So I think I'll give one more question, more an overall question, and then we'll go for the break. This one is directed to all of you. When we reach out to local commissioners about putting guardrails in our communities before the recreational marijuana industry comes to our state, in this case Florida, they state that there's nothing they can do because there's a moratorium in place. How do we go around that, and how do we make permanent rules to protect our communities and youth? Is there anyone of the panel who would like to answer?
I can take that one since I am in Florida. So a moratorium, for those of you that don't know, is kind of a stop for a certain time. It's like we're going to stop and we're going to study the issue, and we're not going to allow any more to happen, and we'll regroup kind of later. I personally love moratoriums, and the reason why is because it's an easier ask on local lawmakers. When you're asking them to outright ban something, they have to get their whole legal team involved. It's just a harder pushback, but it's really hard to argue with a stop and study approach. And the stop and study approach can be renewed multiple times. So for example, in my county, in Pinellas County, when we were dealing with the opioid issue and specifically pill mills, we placed a moratorium on new pain clinics from opening. And I use the term pain clinics very loosely. We renewed that moratorium for like 3 years until really there wasn't an issue anymore, because the state legislature took action and redefined how we looked at these issues. So sometimes a moratorium can be really successful because it kind of puts your local municipality on hold while we wait for the state or the federal government to take action. So I personally like the moratoriums. I think that to answer your question a little bit more, I think that while the moratorium's in place, you can continue to provide those local policymakers with all of the information on your issue and the new research and the new data that comes out and the new experiences, so that they can keep the moratorium in place, or when it's time to, because sometimes you can only have them for a certain amount of time, when it's time to look at, moving on to a different action by them, they already have all that information with you. So like Kristin said, it's continuing that relationship and building that relationship and not ending it just because the one thing is already in place.
Thank you so much for that answer. Now, without taking too much time, I'll just announce that we will have a short break till past. So in European time, summertime, it would be 4:30, and I think in American time or EST, it's gonna be 9, 10. 10, yeah, thanks. For those who have not have their questions unanswered, you can always write them down in the Q&A box, and there the speakers can write the answers as well. So I also would encourage you to do that. So for now, we will have a short 7 minutes break, and we'll see you back at past. Thank you so much, everyone. See you soon. Back, everyone. I hope everyone was able to grab a quick coffee, water, or tea, or anything else, and is ready for the second part of today's training. I will start introducing the first two speakers. Sorry. In today's second panel, we'll talk about advocacy in action. And our first panelist in this panel is Dr. Humberto Soriano, and he is an American-trained pedestrian gastroenterologist and hepatologist and nutritionist in Chile, who has studied in the Planet Youth model closely. Dr. Soriano studied medicine and pediatrics at the Catholic University and specialized in gastroenterology, hepatology, and nutrition at Texas Children's Hospital for the last 6 years. Dr. Soriano has served as the director of the Chilean Pediatric Society between being in 2015 and 2016 its vice president and president of the Pediatric Congress. Since 2017, Dr. Soriano is president of the Chilean Society of Pediatrics and being the first president to also be a representative of the Universidad Católica. And Dr. Soriano has published more than 60 original articles and chapters. And under his leadership as the president of the Chilean Society of Pediatrics, Chile has decided to implement Iceland's evidence-based drug abuse prevention model in 100 cities and municipalities in Chile, a country of 17 million over the next 2 years. And our second panelist is Dr. Kevin Sabet, and he is an affiliate of the Institution for Social and Policy Studies and the Medical School at Yale University, and is dubbed by NBC News as the prodigy of drug politics. He is an author, consultant, and advisor to 3 US presidential administrations and assistant professor. Kevin Sabet has studied, researched, written about, and implemented drug policy for more than 25 years. He is currently the president and CEO of SAM, an acronym for Smart Approaches to Marijuana, which is a non-profit organization he founded with Congressman Patrick Kennedy and David Frum. With his experience in government administration, Dr. Sabet also regularly advises foreign governments and several non-governmental organizations and serves as an international role as an advisor. Thank you both for being here. We are honored and sharing your valuable experiences and successes. So first up, Dr. Humberto Soriano, the floor is yours.
Thanks, Cressida. I'm trying to share my screen. I think it's going to work out. That was a kind introduction. I'm just a pediatrician who've been in the right place at the right time. And if I can, yes, there I'm sharing the screen. I'm a pediatrician from Chile. I'm at Catholic University. I'm the president of a prevention medical association that created with Mariano. I really feel honored and privileged to share with you and to learn from you and with people with such pedigree as Kevin and Mariano and Amy and Kristin. So thank you so much for inviting me, Amy, and proposing me Mariano. I'm also
sorry, one question. Please, if you go to interpretation, because apparently some audience can't hear you, if you have the interpretation button, you have to choose English as a channel. Otherwise, people might not be able to hear you.
Where do I find the interpretation channel?
In the bottom, on the right, there's a globe.
Let me
It
stop.
says-
Let me stop sharing.
Yeah,
Bottom right, more.
and there's a globe interpretation. Or
let's see.
more, yeah, or more, and then it's written interpretation.
Okay, I'm at the moment chat recording interpretation. Yes, English. Perfect.
Yes.
That will work. Is that perfect?
Yeah.
Okay.
And then you
Thank
can mute the original audio, otherwise you will hear the translator.
Oh, okay. And wait, how do I mute the original audio?
It also says there. It also says interpretation, and then it says English, and then you can also it says mute.
Mute original audio. Perfect. Okay.
Perfect.
Good.
Thank you so much.
Yeah. So as I was saying, I'm just a pediatrician. That's why these technology things are sometimes a challenge. You know, I thank you, Cressida, for talking about all I had done, and maybe I'll show you a couple of pictures to tell you what happened with me. I studied medicine in Santiago in Catholic University. Then I trained at Texas Children's Hospital, which is in Houston, the drug distribution capital of North America. That was my office there in the Aero. They hired me to stay as professor in Houston. Then I went to Children's Memorial Hospital. I did research on liver cell transplantation. And then I ended up as chief of a pediatric gastroenterology and liver transplantation division in Philadelphia. And then I got divorced. And I thought, I want a country that's less into money and less into materialistic things and more into people. I want to go to my first or second home because I feel at home in both. And I went to Catholic University, and I was lucky enough that I was asked to become the president of the Chilean Pediatric Association. Alas, I met Mariano, who educated me. He educated me on what were the better ways to combat consumption in children, which is something we all agree upon. I'm thrilled that so many people from so many countries are listening, because it's such a small world, and to be together working for the sake of children is magnificent. This is a picture of a lake in Burlington, Vermont. 2 years ago, I had the privilege of giving lots of lectures there, and I gave grand rounds in psychiatry, and I started with this picture saying I have no conflict of interest, although I have to say this is not entirely accurate. I have a son who is a recovering addict. I have a father who was an alcoholic, and I have a brother who is also an addict. So I really have a conflict of interest in that. I am passionate and totally committed for children free from drugs and alcohol. So when you talk to me about legalizing marijuana, I looked at the evidence and say, what are the weapons we're going to use to let people see the truth of how we protect our children, which is the goal of many of you. So in this next 15 minutes, I will talk about the problem of marijuana in children, how drugs hurt, how we can come together, how we did come together in Chile, and how we set up a prevention model that is beginning to work. Well, marijuana consumption in 2015 in Chile was the highest of the whole continent. And when I say the continent, I say North and Central and South America. You can see the US at 22%, but Chile is way above all the other countries in consumption of marijuana amongst children. And why is this? What is the problem? Well, this was some graphs that were produced while Mariano was in charge of the drug office, and showed that the risk perception had plummeted in the past 15 to 20 years, while marijuana use was skyrocketing. Something had to be done. And we were falling prey to the same rhetoric, to the same strategies and lies that we were given by the tobacco companies, by the big tobacco that told us that cigarettes were good for asthma, that doctors smoke Camels, that scientific evidence showed that Chesterfield was good for you. Well, now we know that we were being fooled, but there's a saying in America that says, fool me once, shame on you, fool me twice, shame on me. Let's not let the big marijuana fool us twice. That would be a shame on us. So this is our pro-marijuana actress. You know, she is famous in Chile, and she has made a living out of promoting marijuana and out of taking advantage of poor little ladies who have children with epilepsy, selling them marijuana products because she proposes, she trains them to grow marijuana and give it to their children, something which is terribly wrong. But that's the lobbying of big marijuana with Congress, with authorities, with the National Drug Office, infiltrating political parties, hiring researchers, just as tobacco did. They hire researchers from the NIH to work for big tobacco, doing seminars, etc. And there's a lot of earnings and conflicts of interest. They earn a tremendous amount of money. Fortunately, we are making a little bit of headway because we have set up this coalition between scientific societies that include even the Chilean Medical Association. We've pushed back with a shoestring budget, but we've pushed back enough that she was even asked to leave one of the political parties where she was proposing an agenda for pro-drugs. And you have to be careful with what they tell you, because big marijuana strategy is cherry picking. They try to sell you a bucket of cherries, but they only show you the really good ones and not the rotten ones underneath the surface. Because drugs hurt, and more every month we see more evidence, more medical scientific evidence that drugs hurt children's brains. Why? Well, in the first place, the marijuana that I smoked when I was a teenager was 7 times less potent. Then we used to say marijuana is not addictive. Now we know that 1 in 6 people become addicts. You know, we were 6 children in my family. Our dad, who was a pediatrician, said, go ahead and drink, because you have to get trained in drinking appropriately. And because we were 6, one of us became an alcoholic. So marijuana is not medicinal. And I hope I can show you a little bit of that in a minute. The children's brain is more vulnerable in neuronal pruning and axonal covering of the myelin sheath. The cables of the children's brain is still not protected. And this is not published in a throwaway magazine that you find somewhere. It's a New England Journal of Medicine telling you children's brain is more vulnerable. The regular use of marijuana, according to Lancet Psychiatry, causes learning disabilities, lowers school performance, increases dropout rate, lowers the IQ point. I mean, who has too much IQ? Who is too intelligent that can afford to just become a little dumber? I know I'm not. I'm not. So marijuana hurts children's health. And data from neurospec imaging show brain flow decreases in brain exposed to marijuana. You know, I look young, but I'm, not that young. And marijuana ages your brain. Do you want to have an old brain or a young, resilient brain. I know I want to keep young. So it drives them mad, increases the risk of psychosis, schizophrenia, and other medical illnesses. It lowers achievements, it gives you chronic bronchitis, and this has been continues to be published over and over and over in very reputable journals. It also, as Kristin said it a lot about equity, you know, marijuana consumption affects the poor much more than those who have more education or more wealth. So marijuana legalization also increases consumption. And this has been seen over and over and over, and we need to keep on repeating it, lest they forget. But in terms of affecting the poor, this is a key issue in advocacy, because as Amy was saying, they're going to tell you we're all about freedom, we're all about left wing, we're all about protecting the vulnerable. Well, if you really want to protect the vulnerable, you need to be against consumption in children. Fortunately, amongst people, there is a huge consensus that children ought to be protected. So this is not a left-right wing issue. This is a non-health issue, particularly for children. Marijuana use increases vehicle accidents, fatal accidents, and legalization in Washington doubled motor vehicle deaths. These are hard data. And in Chile, and I'm sure in your countries as well, one of the first concerns of parents is keep drugs and alcohol out of schools. Nobody wants their children to consume drugs and alcohol. So how do we come together to advocate? Well, a lot of people about 10 years ago, starting from the Chilean Pediatric Society, started a group. We got together in a WhatsApp. I don't know if you use WhatsApp. It's one of the social media that allows, you know, a few dozen people to talk and chat and share information and share strategies and plan. And we've had this for over 10 years with different scientific societies, key people who are really interested in prevention. And the focus is on children. You know, don't tell adults not to have a beer with their barbecue. That's not going to work. But do tell children, don't share it with your children. Do tell adults, don't get drunk in front of the children. And there's great research here in Chile in a foundation I'll tell you about in a minute. Prevention is the goal of pediatricians in many countries. We created a prevention medical association, constant communication via social media. We hired a communications company. It's key to be in the news, to be in the press, to have experts in communication. We doctors are not experts at communicating, so we self-train. We help as experts to train us, and we had very many meetings with the legislation and with the executive power, and said it clearly in no uncertain terms: marijuana legalization is bad for a country, is bad for children, is bad for business. So we ended up doing a big seminar on prevention that I'll tell you about. We asked Epistemonicus, a trusted evidence-based local organization, to study whether marijuana was medicinal or not. This is the logo of Epistemonicus. It's on the web. It's a tremendous resource in English and Spanish. They are partners with Cochrane. Cochrane Foundation is the data organization that tells you how do you treat an otitis media, with amoxicillin or with cefuroxime. You know, all those questions that we doctors have about how to better treat patients. Well, Cochrane Community and Epistemonicus help to answer us with this kind of studies. You know, all the studies which are pertinent, which are giving you an answer. And after studying cannabis and its components, the conclusion was that they don't produce cure, but they damage patients' health. And it fell into three categories. In anorexia nervosa, it hurts and does not help. In chronic pain, it may have slight benefits, but adverse effects outweigh the benefits. And number three, things like Tourette or chemotherapy-induced nausea, it's not clear if there's a benefit, but evidence is low and side effects are common. So caution is the word. So we were in Congress many a time, and there's a picture of Lady Dr. Vera Gaete, who started the ball rolling. It's important to give credit where credit is due. Here we're meeting the Secretary of Education, the Minister of Education, because it's key. We're meeting the presidential candidate, who fortunately became president and helped us a lot. To my right is Sebastián Piñera. To the right of him is the president of Iceland, and to the right of him is another politician. We as soon as he was elected, we wanted to talk to the First Lady, because First Ladies have something about children, they care for children, and she helped us as well. And we try to transmit the evidence and not and try to train people on what we do know about consumption and health of children. So we were still baffled because marijuana consumption kept on climbing in Chile. We were record holders in 2015. What could we do? How could we protect our kids? Because the drug on wars usually fail. Scare tactics don't work. If you give
I'm sorry, I just want to let you know there are 2 minutes left.
Okay, so what does work? The Icelandic model, we saw it worked. We decided to invite them. Why Iceland? Because we're all the same. You treat a tonsillitis the same in any country. And Iceland did better than Malta. So these are the 2007 seminar where we brought about 1,500 people, both online and in presence. Those are the people who participated. We started a pilot project. 10th grade were interviewed, and we got data. And we got data that marijuana use was really high, but parents don't know where youth were in the evenings. That made them consume more. We found out that children in Chile were bored with school. So, making schools funner is one of the ways to prevent marijuana consumption. And children who went out of the house at midnight, which was common in Chile, had 2 or 3 times more likelihood of consuming marijuana. If they were out after midnight, the same thing, more evidence that they were going to consume marijuana more often. So finally, we got the government enthusiastic with setting up this prevention model in all of Chile. And I'm happy to tell you that marijuana consumption had in the pilot studies a decrease from 29 to 18% from 2018 to 2020. Now, you could tell me this is a pandemic, but sure, the pandemic has strengthened the things that protect children. Things that protect children are family time, sports, extracurricular, monitor activities, and a message that says delay consumption. So to finish, there's my 2 daughters who really moved me to work. I want them to grow up in a drug-free world for children, and a real privilege to work with all of you, available to help in any way we can.
Thank you so much for your presentation and for showing the statistics that you have been presenting in this presentation about the effects marijuana has, and also the problem of addiction. As well as what you said, like the children ought to be protected. That's the main goal that we should work on, and everyone can get together on that one, no matter which side of politics you are. And also great to see so many good examples of your work, like your advocacy work, the meetings you had all over the world. So thank you for that, for sharing. We will get to the questions after Kevin's presentation. So for now, I would not like to take more of your time, and I will give the word straight away to Kevin.
Hi, everyone. It's really an honor and pleasure to be with you.
I'm
Thank
sorry,
you so
Kevin.
much. Oh, yeah.
I can't hear you, so you probably have to go to the interpretation as well. You have to select English as a.
Great. How's that?
Let me
Is that
check.
better?
Yeah, much better. Thank you.
Okay, good. Well, I want to thank everybody for having me. First and foremost, World Federation Against Drugs, my good friend Amy Ronshausen, the Drug Free America Foundation, and really all of you, many of whom I haven't seen for quite a while. And it's really a pleasure to be with you. That I really have enjoyed the presentations. In my time this morning, I'm on the Pacific time zone today in the United States. It's great to be with you. So I'm going to be sharing some lessons learned, and I hope we can get into a conversation as well about what we have learned. I'm going to try and present kind of as quickly as I can so we can get to the Q&A. For those of you that don't know, I'm the head of a group called SAM, Smart Approaches to Marijuana. We're a nonpartisan nonprofit organization based in the United States, founded by myself and former Congressman Patrick Kennedy, the Democratic congressman, son of Ted Kennedy, the former senator and nephew of JFK. Patrick and I started this 8 years ago, and it's so gratifying to see people talking now about big marijuana. And Dr. Soriano, thank you for that. And talking about, the potency and some of the things that we hadn't been hearing as much maybe 10 years ago, we're now hearing a lot more of. I think there's a lot more awareness, and that's good. Just an anecdote, we founded SAM, 8 years ago now, more than 8 years ago, because we could see how the rise of the medical marijuana industry was really changing the face of business, and it was a huge business. And we knew that as states began to legalize, and we were going to go towards this trend of acceptance, that we were going to see, a lot more investment, a lot more lobbying influence, and we had to try and get out ahead of it. And that's what we've been trying to do. So we've been trying to educate people on the science, promoting health first smart policies that reduce use and its consequences. And very similar to what Dr. Soriano was talking, and this is absolutely a lesson to build coalitions, is work with existing organizations that have a lot of credibility, especially outside your drug prevention sphere. It's really important that we widen our scope and not only work with people who agree with us, but maybe work with others that are inclined to agree with us, but they don't put this as a first priority. I mean, you can imagine how many priorities there are among some of these organizations I'm showing you, the Medical Association, especially since the pandemic, but even before the pandemic, all of the things that they were focused on, they're not going to be focusing on cannabis marijuana policy unless we put pressure on them to say, this is important, here's how you can help. And you often have to do the work for them. That's actually a lesson I'm going to share with you, is that you often have to do that work. They're not going to do the work. They're busy. You have to get these coalitions together and do the work for them. And they will many, many times agree. We also work with many other folks. But let me tell you why we care about the marijuana issue. And this is another lesson learned. So I'm going to be weaving what I'm saying with the lessons learned. We care about it because today in the United States, the average marijuana user used to consume, I shouldn't say today, so 30 years ago, used to be like they were consuming a 20-ounce cola worth of caffeine. That's what they were consuming. Now, if you look at caffeine, the marijuana user in terms of THC, the active ingredient, the average user is using much more often and much stronger stuff, that they're essentially consuming 33 grande cappuccinos. That's the difference in the THC level. If you look at the caffeine difference between these two beverages, that's the difference. One Coke versus 33 medium cappuccinos, okay? So that is why there's a sense of urgency. And the other part of this that's a lesson learned is we have to use visuals and language that people can understand and relate it to in their life. People don't know what THC is unless they're in our field or they used a lot of marijuana. We have to explain to them THC is what gets you high, similar to the active ingredient in cola like caffeine. And again, to give an example, as I would say to somebody, the reason we care about this now is because people are used to consume a 20-ounce cola, the average, caffeine consumer. Now they're consuming 33 cappuccinos. That is the exact same. That's what we're talking about with regards to marijuana. And, we have to talk in that language that people can understand. Some wins that we've all had as a field with Amy, with many other organizations. First of all, in the United States, we still do not have federal legalization. We have pushed back in many individual states, and it's difficult because in the US we have 50 different jurisdictions. It doesn't really make a lot of sense globally. I understand that you could have a state jurisdiction that completely conflicts with the federal government and then nothing happen. It doesn't make sense to me either as an American, but that is the strange world we live in right now. So several states could be legalizing, but we have pushed back. I'm going to tell you how. We do not allow the banking to go on, which is what the industry wants. They really want banking to happen because they want access to the US financial system, which is essentially the gateway to the global financial system. But we have not allowed that to happen. And we do have support from the current US administration. The Biden administration has said they're not interested in legalizing marijuana. In states that have legalized, what have we done? Well, you can actually still do a lot. So we have public health restrictions in various states, whether they're Montana, Vermont, and now Colorado, which of course was ground zero. But last year, Colorado passed a measure to study the potency of marijuana to look at limiting potency, which we had never seen Colorado even come close to doing. But I'm going to tell you why that happened and what lesson we can learn from that in a minute. And also legal challenges, really working with lawyers behind the scenes to challenge things on the local and state level. These things are very important. And, again, we are confronting this huge wave of acceptance. I mean, whether it's legal in one state or not, globally, there is a huge wave of acceptance similar to what it was with tobacco 50 years ago. So we're doing this in that backdrop of massive global acceptance. One way we do it in that backdrop is a lesson that I'm calling meeting people where they are. Now, what does that mean? Well, it means you have to understand often how people misunderstand the issue. Let me give you an example. People in the United States, the average person thinks that our jails and prisons are filled with marijuana users. And if we legalized marijuana, we would have basically no appreciable prison population. Now, the reality is about 0.3% of people in state prison are there for marijuana possession. Okay, so it's not a reason why people are in prison. However, if I just begin with that statistic, they're going to counter with another statistic. We're going to go back and forth. People, it gets you nowhere, unfortunately. Okay. Now, if you're arguing in a formal debate or some kind of fact check thing, that's a different story. You absolutely want the facts. But if you're having a discussion with somebody who thinks our prisons are full of people, with convictions of marijuana, rather than argue with them, I simply say, okay, well, whether they are or not, we don't want to be putting people in prison just for using marijuana. That's not a good use of resources. So we agree there. Let's agree with you on that. And then now that we've met them where they are and you have some credibility with them, you can now start opening the door to issues they may have never considered. So my next thing would say, well, did you actually know that when you look at the statistics, we are seeing a lot of psychosis and schizophrenia, mental illness, which can lead to crime, connected with marijuana. And you're able to open up and have that conversation. There are many other examples of meeting people where they are. They may not believe that it reduces eight IQ points. They may not believe that it reduces, learning. So what do you do rather than just throw them an article to read? Unless, again, some people, they want to read an article and that's good, but most people don't. So what do you do in that case? Well, again, in that case, Kristin talked about this earlier. If I'm talking to young people, I meet them where they are in terms of, yes, they want to rebel. So I want to talk to them about the marijuana industry and I want to change the conversation. I don't want to talk to them about how dumb they might be if they use cannabis, because they'll say, well, I have a friend that uses marijuana every day and he's a straight A student. So Kevin, you're wrong. So that's not going to lead us anywhere good. So instead, I want to pivot the conversation, meet them where they are, say, well, about the pharmaceutical industry, don't you? Because by the way, most kids don't know anything about the tobacco industry. That's where the tobacco analogy is great for anyone basically above 30, but anyone younger than 30, they're not in North America. Now in other parts of the world, absolutely. But in North America and in even some parts of Europe, saying the tobacco industry, they don't remember those advertisements. So unfortunately, those advertisements are all over Southeast Asia now and Africa. So they absolutely, in those contexts, tobacco would be relevant, but you want to bring relevant context. So for people in the US, for kids in the US, I talk about pharmaceuticals because they understand that that was a greedy industry. The other thing we need to do is to think about unexpected messengers. Okay, well, what does that mean? Who could they be? What would they say? Well, an example of an unexpected messenger, we wanted to increase treatment in a community. So there was a meeting by the council to talk about that. Now, we could have brought treatment workers, doctors, really smart people to talk about why treatment made a lot of sense for the community. Instead, who did we bring? We brought a chief of police to talk about treatment. That was an unexpected messenger because the council was expecting to hear from social workers and doctors. Instead, they heard from someone in law enforcement say, you know what, this community needs more treatment. It's the same thing in the marijuana discussion. We need to think about unexpected messengers, and I'm going to show you some later. We have to understand, and another lesson is to learn from, unfortunately, the groups that are opposed to you, because they're often very smart. I mean, I have to give credit where it's due, folks. We have a plant marijuana with super high levels of THC with absolutely no studies showing it's effective for medicine. And they've duped 90% of the American population in thinking it's a legitimate medicine. We have to give credit where it's due. That's a very smart thing that they did. So let's learn from them, frankly, and let's learn from the global movement to legalize drugs. The global movement to legalize drugs has used unexpected messengers. Who's on stage right now at a conference talking about how the war on drugs has failed and we need a new approach, which they don't even say what the new approach is because they want everyone to agree with them on the first thing. They don't want to disagree with anybody. So they're going to be as vague as possible. Again, it's actually a very smart tactic. And they're very vague. So they have a big tent and they can bring people in and they're saying, who's on stage? Are these a bunch of people who are using drugs every day? Are these people who are, who are they? Well, I don't know. Let me show you who they are. One of them is one of the richest men in the world. If you can recognize him, Richard Branson. Another one is the former president of the Swiss Confederation. Okay, it's pretty good. Another one of them is the former head of human rights for the United Nations. That's pretty good. Another one is the former head of the Global Fund of AIDS, which has raised billions of dollars from conservative and liberal governments alike. So they have credible people unexpectedly saying, let's essentially legalize drugs. Now, they don't say it exactly like that because another lesson is they are very careful about their audience. But we have to learn from that in terms of getting folks who are unexpected messengers, prominent people saying the same kinds of things that we want them to say, really on our side of the issue. An example of unexpected messengers we have been working with for the last 8 years include a couple that I highlighted in my book, Smokescreen. And I didn't talk about my book, but I released the book last April, actually on April 20th, which is the unofficial marijuana holiday, called Smokescreen, What the Marijuana Industry Doesn't Want You to Know. And in that book, I highlight the work of James and Charmaine Hayes, who are in the belly of the beast, Compton, California, the place that brought you the word chronic and marijuana. And they were out there telling folks to vote no on marijuana shops, and they won. They won in Compton, California. There are no non-medical marijuana stores there because of these two people. They didn't have a lot of money. They had $500. I'm not going to go into detail about their lesson. You can read about it in the book, but that's an example of an unexpected messenger. Another lesson learned that we have is what I would call the hard to attack messengers. Folks, let me tell you something. If I go to, let's say I go to San Francisco, California, and talk about the negatives of marijuana. I mean, they just see a 42-year-old guy, talking about marijuana. They're going to attack me and say all kinds of things. If I bring, 15 angry mothers and fathers with stories about why marijuana is bad because of what happened to their kid, it's going to be very hard for those folks to attack. If I bring 15, 14-year-olds to that meeting, talk about how it's impacting their generation, it's going to be very hard for them to attack them. So we need to understand that. It sometimes means putting us behind. It's why I start sending people out to go give a lot of talks out rather than me, because I want it to be people that are unexpected and hard to attack. Just some quick success stories. I'm going to go quickly. We've helped defeat the ballot initiative in North Dakota because we organized a group consisting of judges, chambers of commerce, law enforcement, a broad coalition. Even in places where eventually marijuana was legalized, we delayed it almost a decade because of an expansive, again, employing the examples I just talked about in these very states. And I talk about this in the book. If you have questions, I can talk more about it. New Jersey was something very similar. So we have to take these lessons and harbor them. And one of the big lessons we've learned in the United States is this issue of social justice. And I do want to dwell on this a little bit because this is one of the top issues being talked about in the US. And when we talk about social justice with marijuana, we see that legalization has not addressed these issues. We see there is still a disproportionate impact on communities of color that have to do with far more than just marijuana. They have to do with deep-rooted issues in policing that we need to discuss. We need to have frank conversations on both sides of the issue because there may be a little bit of truth on both sides. We need to get people together and talk about it. But legalization has certainly not addressed the issue. Who owns the marijuana stores? They're not people of color, folks. They're people that look like me. So we have to debunk this myth that this is about helping people of color. Even in the way of monetarily, it's not about helping them, let alone in other ways. We see the pot shops in the density of stores. Oh, this is a new analysis, brand new, 2 weeks old in California, showing the density. And if you understood California, and if we had more time, I could talk about the geography, my original home state, is you would see that the density of marijuana stores are in places where there are high populations of color. They're in those neighborhoods. And that is because, frankly, we know the liquor stores are in those neighborhoods, the tobacco shops are in those neighborhoods, the lotteries are in those neighborhoods. And so in Illinois, for example, we worked with the NAACP. This is Teresa. And we worked with them. The NAACP is the oldest organization in the United States for Black people. And we worked with them on it was called Decriminalize, Don't Legalize. We had to meet them where they were because they did not want to criminalize use, but they were unsure about legalization. They said, well, I don't know, maybe legalization could help. But on the other hand, we've seen how drugs devastate our community. So you know what? I'm good with decriminalize, don't legalize, they said. Meeting people where they were. Would we have done this in Alabama? I'm not sure. I don't know if that would have worked there. But in Illinois, it worked for a few years until our time ran out because we were overwhelmed with money there. But it was very effective for the time. So what are policy solutions in places that have legalized? Again, you have to have some compromise if it has already gone that way. So in Colorado, we can't talk about reversing legalization right now, but we can set the stage for it. We can restrict THC content, which we're working on. We can argue that marijuana industry folks should not serve on rulemaking bodies. We can try to cut advertising. In the United States, it's very difficult. It's going through the courts, but you can at least put that marker there. And really, you know what we need in places that have or even haven't legalized? We need the last two things. We need a science-based public awareness campaign to talk about marijuana because, folks, we are under a tsunami of acceptance of marijuana. We are where we were in the US with tobacco 60 years ago. I don't care if no more states legalize. I don't care if the next president says, I don't like legalization. Where we are right now is under a tsunami of acceptance from all across media. We need to start chipping away little by little. It's not going to happen overnight. There will be a tipping point at one point, but right now we're not close to that tipping point. We need to chip away. Drug to driving, we haven't talked about, but that's a huge issue also to bring people who are going to be unexpected allies. They may not care if an adult uses marijuana in the privacy of their own home, but they don't want people driving. And especially if you bring victims of driving, which we also have brought, you can really make an impact with this issue because people don't want to see this on the roads at all. We have a lot of resources for free on our website, some in Spanish as well. If you go to our website, learnaboutsam.org, we can put it in the chat box. We have a lessons learned, resources. You know, our impact strategy is multi-pronged. And again, we invite you to be part of that with us. If you want us to help in anything you're doing, please contact Brendan. Our website, again, is on the bottom. And I just want to end with, again, unexpected messengers. I mean, the late former UN Secretary General can be seen in this picture, folks. I mean, we have to learn from the folks that have legitimized and legalized substances. We have to learn what they've done, because they've done a very good job, and we have to give credit where it's due, even though we don't agree with them. So let's learn from them. There's a lot we can learn from them. And let's understand, what is the next frontier? Folks, the next frontier has nothing to do with marijuana. It has to do with all drugs. It has to do with not just psychedelics. Right now, we're on the verge of legalizing mushrooms, LSD, psychedelics, but I'm talking cocaine, heroin, methamphetamine, synthetics. That is the next frontier of this. That is where we're going. And so we need to understand that our voices have to come together. We have to build these coalitions now, learn these lessons, and try and prevent it. Because at the end of the day, we need to stop what's happening. We need to help people, and we offer folks hope, okay? The folks that want to legalize drugs offer drugs. They offer further dependency. They offer further suffering. We've heard about, stories of family members and others. We have to offer hope. That is our secret ingredient. That is what we get to offer. If you're interested in my 2 books, the first one I wrote a long time ago now, 9 years ago, it's called Reefer Sanity, 7 Great Myths About Marijuana. It's been updated. And the latest one is Smoke Screen, What the Marijuana Industry Doesn't Want You to Know. We're about to translate that into a few languages as well. Website is there. All my heart goes to everybody. We are fighting this together for our kids, for our grandparents, for everybody, for our society, because we want to make society better. Ironically, we're the ones with compassion, even though we're told we're not, because we want to get people to live a life of freedom. A true life of liberty is one without drugs. So I want to thank you all. I'm happy to answer questions. Honored to be with you this morning. Thank you.
Thank you so much for your presentation. It was very strong, and a very strong statement what you have made. As you said, it's very important. And I think the message of the unexpected messenger, I really liked. It's very important to include as many as possible, not just always be the same representing and be taken seriously. We have to involve everyone who is basically who we might not be able to think of at first, but will actually be able to help us. Thank you for that. We will have a few questions, and I'll start with one to Humberto. You have already answered it a little bit online, I saw in the chat, but I ask you to maybe elaborate a little bit on live as well. What do you consider to be the necessary supplement update in the global conventions on children, women, tobacco, drugs, etc., to achieve better protection against addictive marijuana products that we can see achieved today?
We started talking about human rights last century, and we are now talking about children's rights. And it should be acknowledged that a child's right to grow up free from drugs and alcohol is a true right. Most people believe that children deserve this right. Most people support. A lot of people, Kevin said, are pro the usage of marijuana. And if one of you wants to have a beer or even smoke a joint in your houses without children around, that's in Chile at least, that's a total legal thing to do, and it's a right. And there's a big consensus that people should have the right to choose. However, for children, there's a huge consensus that they should be protected. Prevention is the key. Drugs and words don't work. Prevention includes not scaring, but truly promoting family life, truly promoting outdoors sports activities, extracurricular activities, and if we can get that in a convention, Cressida, I think we're going to make a step in the right direction.
Wonderful. I agree. We have to bring it in a convention indeed, and I hope we can work to that point. Thank you so much for your answer. The next question I would like to ask to Kevin. This question is, what crucial steps do you consider to be absolutely necessary for policy making in countries that have not yet legalized marijuana or cannabis in order to prevent the same development as the ones you described?
Well, again, I think we need to, obviously, preventing it before it happens is much easier. Sometimes it's very difficult because of the money, but we have had victories and been outspent 10-1. So money is not the only thing. Yes, it's helpful. It's good. It can really help a campaign, but it's not the only thing. So don't be discouraged. What I would say is get youth to start being the face of what you're doing, to start talking about what's impacting them, because no politician will want to go against youth. Now, thankfully, most countries in the world do not have general referenda, meaning you would vote on something. I mean, there are countries in Europe I know that do, and obviously Canada and other countries, some do, but it's much harder to do a referendum, meaning a vote of the people on an issue in really every other country other than the United States. So that's good for you. That means that's actually much more helpful, because it means you have to convince 100 politicians, not 10 million, 50 million, 100 million people that are misinformed. So establish those relationships with people in power, get youth up front constantly, but don't overdo it. Inform them with information. There's also a way that we can overdo it and be a pest. So if we send them a study every time it comes out and forward a long email with caps lock, even though we're passionate about it, you probably will turn somebody off. So be a steady and smart counsel for that member, for those elected officials. And again, have youth be upfront as well. Somebody brought up Canada. Maybe I can just address. I'm actually in Canada right now, believe it or not. So, and I would show you the mountains of Vancouver, but we're having a cloudy day. Both Canada and the Netherlands, I mean, because I saw somebody bring up the Netherlands. I also saw somebody bring up the United Nations. I have a funny story. I used to help represent the United States at the United Nations when I was in the government. And, we would joke around with our friends from the Netherlands and kind of, joke back in the day and say, oh, are you guys coming to the UN high? Or, did you find a pot shop here in Vienna, as a joke? And they would laugh, because we would make kind of light that the Netherlands had legalized. They were known to be, pro marijuana, not the people as much, but the country, because it had legalized a long time ago. And starting when Colorado legalized marijuana and some other states, when we would go to the UN, it was like we had our feet in our mouth, as we say, meaning, the Dutch were now looking at us and saying, well, Kevin, Colorado and Washington, not only have you legalized, you have candy bars that are 90% THC. You have dabs that we've never allowed in the Netherlands. You have 60% THC products. What happened? I thought, and so it's just, it illustrates how quickly things can change, because we thought we would never have that in the US. And then the Netherlands was the place if you were going to have it. And now the Netherlands has limited THC products. They do not allow the same things in the US. Canada is also limited, although there's a new report out of Canada last week that shows use and heavy use and consumption has gone up since legalization. The underground market, although it's shrunk a little bit, it's still very strong. It is thriving. The driving issue is a huge issue. So there are actually, it's very interesting to see how these things have not gone well. And we can have a whole discussion on Portugal, which maybe another day we can have. I think that would be a good webinar. And so we actually don't see great outcomes from either country. The Netherlands did this 40 years ago, and no other European country has followed them. Luxembourg may in a very, very limited way. Of course, it's a very tiny country, maybe following them, but that's 50 years later. So if it was such a success, we would have seen other countries, I think, in Europe much faster going towards that. So it's not going that well in Canada. British Columbia, by the way, where I am, let me just tell you this, has the worst opioid problem in the Western Hemisphere, much worse than the United States. I'm not saying that's because they legalized cannabis. They've had a problem of opioids for a very long time. But we have to understand this has not brought the answers. We were told if you legalize cannabis, fewer people will use opioids. Well, that's definitely not happening here. It's not happening anywhere.
Thank you so much for your very great answer. And indeed for also answering the other questions that have in the chat box and comparing the countries. I also had a question for Amy from the previous round, and I'll give her the floor for that now. I will post the question. Let me see. It was aggressive marketing of marijuana products to reach the target group of girls and young women, such as beauty products, tampons, fitness supplements is growing. The same age group of young adult women is also the age group in the world expecting their first or second child. What policy changes do you consider necessary to protect girls and young women and the children they carry?
A great question, and really, in my mind, it's one of the disturbing issues on this, because you do have the fierce marketing campaigns toward young women, and then also pre and postpartum women. So I will quickly highlight one of the things that Kevin's organization did when they found that the marijuana industry in Colorado was specifically targeting pregnant women in making recommendations for medical marijuana for use for nausea during the first trimester. They called them out. They went to the media and showed them these advertisings. They made up a catchy little campaign that they put out, and they held press conferences. And then they also, so it was what we had talked about earlier, the visuals that are happening in the community and that emotional story backed up by the science and the data, because then they're showing the data of the women that are using, and then the research that's associated with why we know there is no way that this is good for that population, or any population, but especially that population. So I would say doing something like that. In my state in Florida, since we have legalized medical marijuana, we've seen almost a 300% increase in pregnant women using this product. So we're looking at doing a specific campaign to educate that group of people, but then also looking at the research as to why is this happening? Are they not getting the prenatal care that they need? Are they using because they think it's harmless? Are they using because they're being marketed toward? What we need to understand the reasons behind it. When it comes to the products, I think I've told this story before. I have a subscription to a beauty box, and I bought this beauty box subscription because my 16-year-old niece also has it. And so I wanted something that we could have in common and that we could talk about. And hey, look this is the mascara that we got this month in the beauty box, or this is the lotion that we got. My first item in the box was a lip gloss that was infused with CBD, and it had a big pot leaf on the lip gloss thing. And so immediately I'm thinking, oh my goodness, this is the same box that my 16-year-old niece got, and this is what she's seeing. How am I going to explain this to her? So I actually looked at the ingredients in the product, and it was saying that it had CBD in it, and it didn't. The word cannabidiol was nowhere in the ingredients list. It did say hemp extract, but there could be a hemp extract without there being a CBD in there. So when you're looking at these products that are being marketed, to really look at the consumer protection, the false advertising, and look at who's regulating that in your area, and is there some education and policy change you can make at that aspect. But also something that Kristin brought up, the 4 Ps, the place, price, product, and promotion. So this is where all the regulations really come in, with the products that are being marketed and the promotion of those products. So maybe, how are they promoting those products in your communities to those young girls? Are they using cartoon characters? Are they using false advertising? So things that you might be able to ban. So I hope that kind of answers that.
Definitely. Thank you so much. That really does answer the question. I have one last generic question. Let's see who is able to answer it. That would be, how many people are actually using marijuana, and is it not the majority of people? Who would like?
Yeah, I mean, look, obviously it's different from country to country, but let's be clear. The vast majority of people don't use it at all. Even in the US, where we've seen such a big increase over the last couple of years, we're talking about 11% of people who admit to have used it in the last month. It's about 20% over the last year. And in terms of people who have ever used it, it's not even 50%. It's around 50. Even if you think that's a low number, okay, half have tried it. You got to remember, most people try marijuana and actually don't like it. The vast majority of people who try it don't like it. And then the other group, that's the next biggest block of people, they try it under 5 times. Then the next biggest group of people, they use it in one phase of their life, like 6 months in college or a year or whatever. And so the vast majority of people actually grow out of it. They don't want to use it. Unfortunately, with today's THC levels, we're seeing more and more people in the smaller group of those that are addicted. We're seeing that group grow because, obviously for all the reasons we've talked about today. But, I do think it's important to emphasize, especially even among young people, that this is not something that's being regularly done by all, because listen, think about why alcohol is legalized, okay? Alcohol is not legalized because it's good for you. Okay? Alcohol is not legalized because we think everyone should drink. A big part of why alcohol is accepted in our global society is because it's used by so many people. And so it's very difficult to prohibit that. So that's why the argument for marijuana is very different. I think you can prohibit it, even though some people will still do it. Because it's not the vast majority of people for thousands and thousands and thousands of years. Like alcohol is a staple in our cultures and really in global culture. So it's very different. It's I think of it like a speed limit, and I like using this analogy. You could have a speed limit on the highway. Some people will speed, and that's okay. They shouldn't, but they will. That doesn't mean you should get rid of speed limits just because 20% of people will go over the speed limit that day. You don't just get rid of it. You have it there to discourage people, because imagine how many more people would drive faster. I know I would, if there was no speed limit there, right? So that's the way that we want to use it to discourage. The law should discourage people. It doesn't mean that it's going to discourage everybody, but it should discourage the majority of people. And I still think it does that. And that's why I think it's important.
Thank you so much. And as said in the chat already, it's a very good analogy with the speed limit indeed. I think that's a very good point you made. So again, I want to thank all the speakers today that joined us and all the participants. And for now, I would like to give the word to Amy for the closing of this webinar. It was a pleasure to moderate and introduce every one of you. So for now, Amy, the floor is yours.
Great, thank you. And you guys will probably be happy to know that I forgot that I was going to do closing, so I don't have anything really specific prepared. So we'll get to a close very promptly, but I just want to thank all of our panelists, Mariano and Kristin at the very beginning, Humberto and Kevin for finishing us off here. I think that so many great things were said, and we will follow up with everybody in an email to make sure that you have links to the presentation, links to the recording. And as Kevin said, I think that there are some really good possible follow-up webinars on this issue, particularly the Portugal experience, because that is talked about a lot. But also, I think one of the key takeaways today for me, and this is something that I know, but I forget often because it's hard, is to engage youth. So how do we engage youth, and how do we keep them? Because youth are busy. They're moving up. We lose them when they graduate and then they attend a different school. When they're college students and they're getting involved in their careers and then their possible families. So, once you teach them all this stuff, it's hard to keep them. So how do we engage youth? How do we keep them engaged? And I'd love to hear some success stories on people that have used youth in advocacy engagements. So I think that would be another great webinar. So I'm just so grateful for everybody who was able to log in with us today and participate and listen. And we had so many people in the audience that would be just equally as wonderful as panelists. Just as knowledgeable as everybody else on here. So it's great to see all of them here as well. So I wish you all a great afternoon or evening, depending on where you're logging in on. And I look forward to seeing you all virtually again very soon, and hopefully soon in person one day, so we can shake hands and hug as well. Thank you, guys.
Thank you.
Thank you so much.
Thank you, Amy. Thank you.